Wabwana kuna cervix iko tu wapi peke yake.
The cervix. So people always ask what cancer is. You ask yourself, this disease people call cancer, what does it mean? Cancer is difficult to explain, but in a simple term, it is when the body cells changes on its own and start doing the work which it's not supposed to do. It fails to perform as the body wants it to perform. It changes its color, it changes its shape. The body cannot kill it, the body cannot produce another one. So then if that cell changes from a normal cell to an abnormal cell, then we call it a cancer cell. Cancer can affect any part of the body, starting from the ear to the toe, which means you can get cancer of the skin, you can get cancer of the eye, cancer of the nose, cancer of the brain, cancer of the lungs, cancer of the bones, cancer of the skin, the breast, the cervix, name all those parts. So when cancer starts from an organ, like the breast, we call it breast cancer. But the bad thing is that if it starts from the breast, it can move to other parts of the body. Why am I emphasizing the breast and the cervix and the prostate? It is because these are the cancers which we see most at Cancer Institute. Many patients who come to Cancer Institute, most of them have cancer of the breast, cancer of the cervix, cancer of the prostate. Fortunately enough, this is the cancer which we can screen for. And today here, we are now screening for cancer of the prostate in men who are 45 years and above, because of the statistics shows us that these are the age bracket who gets cancer of the prostate more. And we can screen for them, we screen them for prostate cancer, and if you get the signs of prostate cancer, then we can take on you and we start doing other tests to check really if you have cancer of the prostate. So if you are a man there who is 45 years and above, please go to the right, to the tent there, and then get register. You get checked from there. It's a simple check. They just pick blood from your fingers, and they run it like they're testing for malaria, and it will show.
Myself, Mrs. Falguni Patel, Chairperson, Indian Women Association. I served Indian Women Association from last 11 years on a different designation. Thank you so much, Mehta Group and Dr. Mishra and Mr. Anil Shah for organization and venue and everything. Especially, we do believe to serve Ugandan, needy women's first. We have started prostate cancer, general checkup, and very many things. This time we have included dental camp also, and we are going to continue more. Right now we stay in the Uganda, and we have to give them back everything. So we are trying our level best to reach up to that level for all needy Indian Ugandan women from Indian Women Association. This year from Lugazi, still we are going to do in up countries like Chororo, Barara. Our target is to do 6 medical camp in this whole year in different places.
This is Anil Shah. I am Chief Executive of Sugar Corporation. So first we got an discussions with Indian Women Associations that they wanted to organize a camp related to this cervical cancer, prostate cancers and dental. So as before 3-4 years also we had a camp here, and you know health is very important, and with health, knowing about the health is also very important. So most of the ladies who are working, who are in the community, they are not aware of their these problems of the cervical cancer, and all of a sudden at the last moment when it comes to the third stage or final stage, it comes to their knowledge. So with help of Indian Women Association, we have organized a camp here, and we are expecting, as she told, around 1,000 plus patients to come and get it checked. Mehta group also always is a part of the community and part of the society, and we are always in the front line to help the community and the members of the family. For medical treatments also, like we have also our hospital here, it's a 60-bed hospital, and for our workers and their family members, the whole medical facility is free of cost. And the registered numbers is around 42,000 workers and family members. So it's totally free. And Mehta Group is always in the front line with the society and with the other community to help, because what we learn that we have to give back what we have received from the community. This is our wish and aim and goal to return back to the community. So community should also remain healthy, wealthy and prosperous.
I'm Dr. Mishra. I'm head of Mehta Hospital, which is a 60-bedded hospital. Taking cue from my chief executive, Mr. Shah, I would put it this way, that we have a great opportunity to take care of people who are a part of our workforce and directly linked with the production, and they are working in an industrial environment which is an edge above the average common environment, facing challenges of day-to-day life, and also their health is of prime importance to us. And this is something which our chairman also thinks, that they should be healthy, and there is no restriction when it comes to providing them the best health care. We have a hospital of 60 beds taking care of everything that is possible at the primary health care level, free medicine to free blood test, all the tests, maternity, everything is there. Whenever we need to refer any patient to outside, including transport and food, we support the treatment cost to the actuals, and they are given the complete care when it comes to their fitness and health. So we have an advantage of taking care of a larger population of close to 42,000 in the remote areas of Buikwe district, part of Mukono district and part of Kayunga district also. And apart from the normal employees and their family members, which is constituting 6 members per employee, wife and 4 children up to the age of 18. Everybody is given not only health care, free education, free shelter, free water supply, free electricity, and also free meals to them. So that is what the Mehta Group really believes in, the philosophy of taking care of the employees' basic needs. And we have the advantage of taking care of them. Notwithstanding our own employees and family members, we also take care of the community people when there is a critical issue, when there is an emergency. We provide them ambulance services, we provide them all types of resources which is required by them. So this is the advantage with us, and thank you Indian Women's Association for giving us this opportunity to organize this health camp, where we have the advantage of doing the early screening of cancer. Cancer cases, as everybody knows, it's increasing because of the stressful life, because of the food adulteration, because of lots of plastic uses. And these are the pollutions also contributing a lot towards increased number of cancer cases. So whatever we used to have before when we were medical college students, nowadays we see many people who are suffering from cancer at a very, very early age of their lives. So this camp is definitely going to help us to early detect the cancer cases and take care of the initiative, so that it is not going to the next stage. It is always going to reverse and make the person cancer free. Our philosophy is to always look at the preventive health care, and it's a great opportunity with us. Thank you very much.
My name is Lutajan Kemisi, Mayor Lugari Central Division. First of all, we thank the Mehta Group of companies and the Indian Women Association for coming up with such initiative, because indeed people of Uganda, not Lugazi only, we are having cancer. Everybody is talking about cancer. Cancer is on everyone's lips. But when it comes to the people, they are a little bit reluctant about today knowing more about cancer. By coming up with this such an initiative, it's going to save life. Two, our sisters, mothers, they are the most victims when it comes to cancer. Because when you look at the percentage of men, it's not that big. So by doing this, they've saved our people's lives. Me as a leader, so many people almost look for such services. Because right now, when you go to Kawolo, they refer them to Mulago. By bringing it near to them, it's kind of a service to our people. So it's kind of a blessing. So we thank Mehta Group of Company and Indian community because they've not worked on only workers of the company, but outsider, our own people. They've really saved the life. Not only cancer, they are not only in treating cancer here, they are doing blood checkups, they are doing HIV testing, they are doing blood donation. So what they are doing, it's a wonder to our country. So credit goes to Indian Women Association and credit goes to Mehta Group of Company for saving our people, mostly the people of Lugazi. We pray so that this kind of exercise go and spread all over the country, all over Uganda. And credit goes to the management. This is the first kind of this exercise to happen. We pray so that it happens rotationally, annually, or if it can go even monthly, we shall be blessed. But thank you very much. Thank you very much for such a wonderful exercise. God bless Indian Women Association and God bless Mehta Group of Companies. When you look at the country right now, let's say the world, everywhere they talk about the environmental degradation. So it's higher time we plant trees, we go and I personally cannot stop plastic, but it can go through sensitization. We need to sensitize people more, and right now good enough media has come. People are watching us right now. We should avoid the more use of plastic for our own benefit and for the benefit of the coming community. Because once I plant a tree right now, it is going to benefit the coming generation. So I advise people to plant a tree, and even I advise them to reduce on the use of plastics for the good of our own benefit and the coming generation.